Now, tell us about how imaging has really evolved through the year. And I think mammograms, what we're seeing today, especially at the Miami Cancer Institute, has been such an advance and such a huge help in detecting breast cancer. Is this true?
Yeah, in the last, say 20 years, mammograms and detection of breast cancer has changed dramatically from, very simple x-rays to now, three-dimensional mammograms that allow us to have much less radiation, but yet pick up smaller cancers at a much, much earlier stage and with less pain for the patient. She doesn't have to have as many, maybe as many pictures taken.
Right. That's a tomosynthesis?
Well, or a three-dimensional mammogram. Yeah, and so it's even though many women are afraid of having mammograms because of the pain and how is it going to hurt me, or is it going to rupture my breast implants, or I have many questions from women who tell me, oh, I really don't want to do my mammogram, but these new techniques, these three-dimensional mammograms, wonderful to pick up new very small cancers at an early stage. Plus, it's also important to remember that not all cancers are picked up by a mammogram. It's really important for people to realize that just because your mammogram was normal, it doesn't mean that you don't have breast cancer. Maybe you need an ultrasound, maybe you need an MRI, and remember that the three different ways to do screening are always very important for that specific individual.
Absolutely, as Dr. Wang mentioned. Anything you want to add, Dr. Wang, to that?
No, I think that even if there is nothing to explain the mass, sometimes we will do a biopsy even if all the clinical studies are negative. So some patients may have a mass, they might go to the doctor, get their mammogram and think, oh, my mammogram is negative, I don't have to pay attention to it. They still need to bring the mass to the attention of their primary care, because sometimes we will not find it by mammogram or ultrasound or MRI, and we only find it by biopsy.